Sleep apnea is a serious sleep disorder. It causes your breathing to stop and start repeatedly during sleep. Imagine this: you're asleep and suddenly your breathing hitches. It might sound like a gasp, a snort, or even a choking sound. This is an apnea episode. These pauses in breathing can last for a few seconds to even minutes. They can happen many times throughout the night. Each time your breathing stops, your brain jolts you awake to restart the process. This disrupts your sleep cycle even if you don't fully wake up. The result, you wake up feeling exhausted no matter how many hours you spent in bed. Sleep apnea is more than just a noisy sleep problem, it's a serious health condition. Untreated sleep apnea can have significant consequences for your overall well-being. Think of sleep apnea as a thief in the night. It robs you of restful sleep, leaving you drained and vulnerable to a host of health problems. Don't let sleep apnea steal your health and vitality. Read on to learn more. There are three main types of sleep apnea. Obstructive sleep apnea, or OSA, is the most common. OSA occurs when the muscles in the back of your throat relax during sleep. This blocks your airway, causing those telltale pauses in breathing. Central sleep apnea is less common. It happens when your brain doesn't send the right signals to the muscles that control your breathing. Complex sleep apnea syndrome is a combination of both obstructive and central sleep apnea. Sleep apnea is surprisingly common. Millions of people have it, and many don't even know it. In fact, the American Sleep Apnea Association estimates that as many as 22 million Americans suffer from sleep apnea. Sadly, a significant number remain undiagnosed and untreated. It's crucial to remember that sleep apnea can affect anyone at any age, even children. It's not just a problem for older adults or overweight individuals. Recognizing the potential seriousness of this condition is the first step towards seeking diagnosis and treatment. Sleep apnea isn't just about snoring and daytime sleepiness. It's a serious condition linked to a range of health problems. When left untreated, sleep apnea can increase your risk of high blood pressure. Sleep apnea disrupts your body's natural blood pressure regulation. It can also lead to heart disease. The repeated drops in oxygen levels and surges in heart rate strain your cardiovascular system. Furthermore, sleep apnea significantly increases your risk of stroke, a life-threatening brain event. It disrupts your body's ability to regulate blood sugar levels, increasing your risk of developing type 2 diabetes. The constant fatigue and sleep deprivation associated with sleep apnea can contribute to feelings of sadness, hopelessness, and loss of interest in activities, leading to depression. These are just a few of the serious health conditions linked to sleep apnea. The repeated drops in oxygen levels and surges in heart rate caused by sleep apnea wreak havoc on your body. It's like running a marathon every night while you sleep. Your body just can't keep up. Recognizing the signs. Is sleep apnea affecting you? Sleep apnea can be sneaky. Sometimes the signs are subtle and easy to miss. Other times they're impossible to ignore. Common signs include loud snoring, gasping for air, and excessive daytime sleepiness. Feeling tired even after a full night's sleep is a red flag. If you experience these symptoms, talk to your doctor. Early diagnosis and treatment are crucial. A Section 5 diagnosis and testing. Unmasking the silent disruptor. Diagnosing sleep apnea often starts with a conversation with your doctor. They'll ask about your sleep habits, medical history, and any symptoms you're experiencing. Be prepared to discuss your sleep patterns and any difficulties you're having, any medications you're taking, your lifestyle, including alcohol and caffeine consumption, and your family history of sleep apnea. Your doctor might recommend a sleep study called a polysomnography. This test monitors your breathing, heart rate, oxygen levels, and brain activity while you sleep. During a polysomnography, you'll spend the night in a sleep lab, hooked up to various sensors. The test is painless and provides valuable information about your sleep patterns and breathing. The results help your doctor determine if you have sleep apnea, and if so, how severe it is. Reclaiming your sleep, reclaiming your health. Treating sleep apnea is essential for your health. Effective treatments are available. The most common is CPAP therapy. It involves wearing a mask while you sleep. The machine keeps your airway open. CPAP is highly effective. Lifestyle changes also help. Losing weight can improve symptoms. Avoid alcohol and sedatives. Quit smoking. Addressing sleep apnea is an investment in your health. Reclaim your sleep and enjoy a healthier life. Visit sleepwelliq.com for more information on sleep apnea.